Welcome to this episode of Time, Tales and Thrills, where we explore the fascinating and sometimes disturbing stories of the past. Before we dive into the twists, don't forget to smash that subscribe button and stay tuned for fresh videos every week. We're serving up some mind-bending tales you won't want to miss. Today, we are going to talk about the history of lobotomy, a surgical procedure that involves cutting or damaging parts of the brain to treat mental disorders. Lobotomy, a surgical procedure oscillating between horror and hope. How did this procedure, initially perceived as a miraculous cure, eventually morph into a universally condemned practice? The first lobotomy was performed by a Swiss physician named Gottlieb Burckhardt in 1888. He removed parts of the brain cortex in 6 patients with schizophrenia, hoping to calm their agitation and hallucinations. He reported that some of the patients became more docile after the surgery, but one died and another committed suicide. Burckhardt's experiment was met with criticism and condemnation from his colleagues, and he stopped performing lobotomies. Fast forward to the 1930s, when Portuguese neurologist Antonio Egas Manes rekindled the interest of lobotomies with his innovative technique, leucotomy, which involved drilling holes in the skull and injecting alcohol or formalin into the frontal lobes. He claimed that this reduced the symptoms of anxiety, depression, and psychosis in some patients. Manes's unconventional approach garnered him a Nobel Prize in 1949, setting the stage for lobotomy's resurgence. By the 1940s, lobotomies had become extremely popular, especially in the United States, where an American neurologist named Walter Freeman and a neurosurgeon named James Watts introduced a simpler and faster method of lobotomy, called transorbital lobotomy, or better known as the ice pick lobotomy. This involved inserting a thin metal rod through the eye socket and into the brain, and then moving it back and forth to sever the nerve fibers. Freeman performed thousands of lobotomies, often without anesthesia or sterile conditions, and sometimes in front of audiences. He also trained other doctors to perform the procedure. Lobotomy was widely used on women, gay men, and people with chronic or severe mental illnesses. It was seen as a last resort for patients who did not respond to other treatments, such as electroconvulsive therapy, insulin coma, or psychotherapy. However, the procedure had serious and often irreversible side effects, such as personality changes, cognitive impairment, apathy, incontinence, seizures, weight gain, and even death. One of the most tragic cases of lobotomies was that of Rosemary Kennedy, the eldest daughter of Joseph and Rose Kennedy, and the sister of President John F. Kennedy and Senators Robert F. and Ted Kennedy. Rosemary was born with a mental deficiency due to a lack of oxygen during her birth. She had trouble learning to read and write, and experienced seizures and violent mood swings. In 1941, when she was 23, her father arranged a lobotomy for her, hoping to ease her emotional outbursts. The surgery went horribly wrong, and left Rosemary permanently incapacitated and unable to speak intelligibly. She spent most of her life in an institution in Wisconsin, isolated from her family and the public. She died in 2005 at the age of 86. The true horror of lobotomy began to become more clear by 1950s and was the beginning of its decline. As new drugs and therapies for mental disorders were developed and as ethical and scientific criticisms of the procedure increased. The Soviet Union took action by banning lobotomies in 1950, and soon after many European countries followed suit. In the United States, lobotomy was largely abandoned by the 1960s, although some isolated cases continued until the 1970s. Today, lobotomy is considered a barbaric and ineffective treatment that violates the human rights and dignity of the patients. It is also seen as a symbol of the abuse and mistreatment of the mentally ill in the past. Lobotomy is a tragic example of how medical science can go wrong, and how society can fail to protect the most vulnerable. Lobotomy left behind a legacy of horror and hope, as some of the patients and their families suffered the consequences of the procedure, while others sought justice and recognition. Lobotomy also taught us valuable lessons about the complexity and mystery of the human brain, and the need for ethical and humane treatment of the mentally ill. That'll do it for this exploration of the brutal history of lobotomies. Thank you for joining us on this episode of Time Tales and Thrills. If you enjoyed it, please subscribe and share it with your friends. Until next time, stay curious and keep learning.